Hello, everybody. A very warm welcome of all of you in a special knowledge exchange series by Elets on infectious disease control, which is being supported by Mylan Pharmaceuticals. And we all know that COVID-19 is the thing which the world is dealing with, including India. And there are infectious diseases. COVID is one part, and there are non-COVID diseases also prevalent in India in various states. So this series is about discussing with various stakeholders, various states, and various governance stakeholders in terms of health governance to discuss on the needs, the challenges, and opportunities in the infectious disease control in the country. And as the second edition of the series, we are very happy and glad to have very important stakeholders joining in this discussion, and many some of them will join us later in this session. So right now we have eminent panelists with us here on this virtual portal, and I would like to introduce them and I would like to welcome them here. I will start with Dr. Duryodhan Chauhan, who is Assistant Director for Health Services in Government of Maharashtra. Chauhan साहब आपका स्वागत है, welcome.
Thank you, sir. Thank you. Thank you.
I also welcome here Dr. Umesh Tripathi, who is MBBS and MD Community Medicine and Medical Consultant, WHO NTEP Technical Network, TB Consultant in Headquarter Patna, Bihar. उमेश जी आपका स्वागत है, welcome. I welcome Mr. Viren Shetty, Executive Director and Group COO of Narayana Health, a renowned healthcare group in the country. Mr. Shetty, welcome.
Thank you.
Right now in the screen, the last panelist, I welcome Mr. Hasija, who is here with us. From Mylan, Mr. Naresh Hasija, Associate Vice President, Mylan Pharmaceuticals. Naresh ji, आपका स्वागत है. Welcome.
Thank you. Thank you.
So we start with this discussion. We can see we have stakeholders from government health governance. We have stakeholders from a private but a large group of healthcare in the country, and we have a presence from industry also. So I will start with Dr. Duryodhan. Doctor, COVID is there in all the states of the country, and Mumbai is very bravely fighting with the COVID-19 virus, the pandemic. I would like to take your views on the infectious disease control in the country, and especially in the Maharashtra. If you share some of your thoughts, please. Dr. Duryodhan. Yeah.
Sir, basically, sir, Maharashtra, as you know, it is a very big state. And fortunately, we have good health infrastructure. But somehow, the situation and the number of COVID patients, those who are coming, the speed with their cases are emerging, it was very huge. So when first lockdown was declared, we were not able to decide from where to start and how to start. But the central government was in continuous communication with all the states, and they have guided us regarding this development of these facilities, the dedicated COVID hospitals, dedicated COVID health centers, and dedicated and COVID care centers. So that network we have developed step by step, and fortunately, we have the outcome indicators. Those are very not very encouraging, but not as high as other countries. So we are planning to prevent the deaths and prevent the spread through our network. In Maharashtra, we are having 34 districts, and all 34 districts they have prepared their plan and they have developed these three-tier system for providing health services in this COVID situation. Sir,
Okay, okay. So this is the. I will also come back again to you to know the step-wise approach, how step to step you are going. But before that, let's move from the western part of the country to the eastern side of the country, Bihar. WHO is doing great work in India, Dr. Umesh Tripathi, and Bihar is facing a COVID-19 challenge, and I think there are a lot of good things happening in Bihar also in controlling this COVID-19. And at the same time, TB and hepatitis B are hepatitis is also coming up. Like it's a problem already in India. TB is so. In this scenario, the scenario of COVID-19 pandemic, what's going on in Bihar and how Bihar is dealing with this? If you can just explain us.
So, thank you. Just regarding TB activities going on in Bihar, like definitely this COVID pandemic affected all these activities, all the health activities in the country, which is also applicable to the Bihar. I am agree here, and simultaneously, the definitely the labs about 600 plus 700 plus microscopy centers are functional where TB samples are coming for diagnosis as well as from their treatment are being started. So, in meanwhile, due to COVID pandemic, the many lab technicians are involved in the COVID activities. Meanwhile, due to pressure and direction from the central government, CTD, as well as the state, out of these labs have started the working for TB diagnosis as well as for putting the treatment. But definitely the performance as well as the missing TB cases has increased in this second quarter until now. So in just maximum dip in TB notification was in April, followed by May and June increased. But due to complete lockdown declared in Bihar for June and July and August. So again, the dip was observed in TB case detection in both public and private in the month of July. So all the health indicator and health activity impacted, and recently we had witnessed with the publication in the newspaper that many activated about 10 million peoples and children have not received the desired level of immunization and many activities. So in that way, challenges is being faced by the state in TB diagnosis as well as identification, as well as putting them on treatment due to staffs are involved in COVID activity. But somehow this is being focused to improve the activity simultaneously.
Okay.
Yeah. Along with this other activity like other immunization, as per CTD, as per Government of India direction in during pandemic, many direction are coming to start these activity, and the state is moving on that direction as per guidance from the center as well as the state authorities. Thank you.
Okay, thank you, Dr. Tripathi, for giving us this primary information. And now we can see that we have with us right now Dr. Kapoor, who is Dr. Rakesh Kapoor is there with us, Director in for Medical and Health Services in Uttar Pradesh, and especially looks after communicable diseases. So, Dr. Kapoor, I will request you to please share your thoughts how Uttar Pradesh is dealing with communicable diseases, especially in the times of COVID-19. And apart from COVID-19, there are other diseases also like TB and all. So, how Uttar Pradesh is dealing with it, Dr. Kapoor?
Thank you, organizers. I would just want to add that communicable diseases has been a challenge for developing countries like India always, and the prevention of this is a very important public health issue, especially in our country where the population is more in comparison to the other European countries, and the health infrastructure and the resources they are limited in quantity. As we all very well know, and we've been groomed right since the beginning, that public health is directly related to so many environmental issues, and cleanliness is a very important issue regarding prevention of public health. And prevention is always better than cure. That is the proverb that is goes. And if we want that our populations should be free from such communicable diseases, then we have to improve upon our existing health infrastructure and implement public health measures which are going to go a long way in preventing the spread of communicable diseases. We in UP are constantly working at it, and the challenge is now more so in this present COVID scenario. But even before this COVID had come on, the big issues which we were facing as regards communicable diseases were the onset of encephalitis and AES JE in the eastern UP districts, which used to take so many lives of young children for the last, say, more than 40 years. And things were not to be controlled despite all the measures which were taken previously. But as you all know, that since the last 2 3 years, the way the UP government has taken up the issue, and they have organized a mass campaign in trying to prevent these diseases, and taken up the help of all the departments of the government so that we could fight this menace. And we are very proud to inform you that we have been very successful at it. I'll come to that later on, but as we were talking about initially, that in preventing any type of communicable diseases, there is always the importance of cleanliness, and this also has many aspects to it. We have been sensitized about it by our Honorable Prime Minister time and again, and there has been a general increase in the perception of cleanliness regarding the Swachhata Abhiyan, Swachh Bharat Abhiyan, as you all know about it. But the the matter of cleanliness by itself has so many dimensions involved in it. One is the environmental cleanliness, where we have to work in the field of waste management, pure drinking water, to prevent outdoor defecation, and the other is the sewage disposal. So unless and until these things are taken care of, the general environment cannot be improved. The other issue is the environmental pollution, and all this leads to the process of biomedical and other waste disposal we have in place. Till the time we can clean our drains, till the time we can clean our villages, our ponds, and our drainage systems, we are continuously going to harbor such microbes which will continuously affect the health of our general population. The other aspect of cleanliness, it belongs to the person concerned themselves. We have to implore upon our population the beneficial effects of personal hygienic habits, we very well know that since the time of Corona, which the country has been facing, I would say that it has been a blessing in disguise, and it has taught us how to practice hand hygiene, how to practice respiratory hygiene, and how to have no contact and implement the social distancing norms which are being always told to be followed. But we still see that in our general population, we are not able to do it. And I firmly believe that these are the very big reasons we are not able to control the spread of COVID infection right now in our population. Till the time we are able to implement these norms, because as we are seeing in the lockdown period, we were comparatively safe, but as the unlock phases have come 1, 2, 3, 4, everybody has become so careless about it that people are not following anything. So I would not be talking very specifically on the processes involved, but prevention per se is the key to preventing communicable diseases. If you don't practice prevention, you are going to get nowhere. And for prevention, the most important key factor which I suppose is necessary is the social behavior change and the IEC material which we have to communicate to the patients. If we do not propagate and try to bring about a change in the behavior of our population as regards cleanliness, as regards personal hygienic habits, we cannot bring a stop to the communicable diseases per se. Other aspects which are more specific to disease patterns, I would try to generalize, because I am dealing now with the vector-borne diseases in general, and this is the season for the vector-borne diseases. And we have so many pockets of vector-borne diseases in various parts of our state. The eastern states are affected with the AES-JE menace. We have malaria cases coming from the Bareilly division. And then there is dengue, which is cropping up here and there all over in Lucknow, in the western UP. And recently we had some cases in Mainpuri and Fatehpur, etc. But all along, the growing vector source is also dependent upon the environment there. Second thing is that we have to focus our approach regarding specific diseases also, as I believe that the topics which are covering, the disease topics which are covering here in this workshop or this discussion is basically COVID, tuberculosis, and hepatitis. I would like to add that we already have national control programs running on viral hepatitis and tuberculosis. There is the RNTCP program for tuberculosis, and then there is the National Viral Hepatitis Control Program. And in viral hepatitis, you will all appreciate that pure drinking water is the basic requirement to control the normal hepatitis. As regards the hepatitis B and C, we already have several clinics running here where we are trying to diagnose and treat various patients of hepatitis B and C. And in general, I would like to add that I would try to look up your topics which you are trying to focus on the diseases here, was the advent of new drugs and incorporation of these new drugs into our curriculum is definitely a very big milestone at achieving control over these menacing diseases. And in tuberculosis, we all know that bidaquiline has come as a very big revolution and the incorporation of betacholine treatment in the management of tuberculosis, especially the MDR tuberculosis, is basically our very essential point. So I would like to share, I have this pamphlet in front of me where we have about the hepatitis control program running in about 20 districts of UP, where we are taking blood samples and diagnosing the incidence of hepatitis B and hepatitis C. And then we have treatment centers where we try to follow up the patients. And then there are so many newer drugs, and ribavirin is one of them, which is being provided by the state for the treatment of these drugs. So this is how we have to, keep on gearing up. If we are the newer drugs which I have seen, I'm seeing that's sofosbuvir, daclactasavir, velpatasavir, and so on and so forth. For hepatitis B, we have tenofovir, entecavir, apart from the ribavirin, which has been used regularly. So these are the manners in which we are trying to uh, control the incidence of the infection diseases in our state. But the success story I was initially talking to you about, that since the implementation of the Vishesh Sanchari Rog Niyantran Abhiyan, as we call it, since the last 3 years in the eastern UP, it was started with 7 districts of Basti and Gorakhpur division, and later it was spread to 38 districts, and now we are covering all the 75 districts of UP. We are having this 1 month long campaign thrice in a year, and in this campaign we try to involve all the departments, the education departments, the rural development, the urban development, the Nagar Vikas department, the veterinary department, the agriculture department, and each of these departments is assigned a particular job. And along with that particular job, they are given some specific targets in each district. And by covering those targets, suppose one particular department was given the target of cleaning of bushes. We all know that scrub typhus is a very main component of encephalitis, and the scrub typhus, which dwells on the rodents, is no, the mites are there, and the mites, they are transmitted through the they are found in the bushes, and if we cut the bushes, then we can get rid of this menace. It, apart from the general environmental cleanliness, we are trying to control the spread of infection by that also.
Okay, I think Dr. Kapoor got disconnected. It seems. I request my backend team to Deepak to inform Harshal that he got disconnected, so that we can connect with him once again. He got disconnected, but Mr. Shafqat Khan, who is from Jammu and Kashmir, who is officer on special duty in the Health and Medical Education Department in Jammu Kashmir, he has joined us. Mr. Shafqat, if you can share your views on the infectious disease control in Jammu and Kashmir, please.
Uh, you, as you already know, all of you, that Jammu and Kashmir is situated terrain-wise in a geographical area where we have a semi-temperate zone. The temperatures are, don't go beyond in the Kashmir region. They don't go beyond 35 degrees, and in the Jammu region, we have more of chances of disease, infectious diseases. That is because the temperature goes up till 45 and 48 also. So it is because of the nature of the landscape and terrain that there are the diseases are very defined in each area of the state. Suppose in Kashmir region, you don't have malaria, we don't have plasmodium infection at all. And while as in Jammu, you have lots of cases of not only malaria but dengue also. But overall, as I have witnessed in my tenure and in my work on the ground, as well as the vast experience I've gained in the health sector, I understand that there are two main issues which confront us. That is water and sanitation. I think we will have to be going very strong in the area of water management, water quality, water harvesting, and because the levels of contamination of water, even in a place like Jammu and Kashmir, has become very high. In our state, we have rivers, the river Jhelum, the river Chenab, Ravi, Satluj, Beas, which cross through J&K. We see that the river water quality, even in the quality of the water in the lakes, the freshwater lakes. We had aquatic life. We had very one of the best lakes, second freshwater lake in Asia is in Kashmir, the Wular Lake. So, looking at Wular Lake today, I can tell you that the water quality of water in the lake is not worthwhile. It cannot be consumed. It's not potable at all. And the other rivulets and the rivers which go through our state are also the water has not remained of good quality. Not primarily only because the flora and fauna of the rivers has gone down, but because there is a lot of waste, including human waste, which is going into the rivers and the lakes. And as I understand that our governments or municipalities have to get very serious, they will have to take these two areas of water and sanitation as the key areas for control of infectious diseases in the future. We teach children hand washing, we teach children etiquettes about cough, hygiene, about how you personal hygiene, how to sneeze. But I think we will have to teach our children the importance of having clean, potable water. We should be teaching our children to safely dispose our solid waste, our biomedical waste, our whatever waste we generate as humans. We'll have to be very serious about these two areas. And I think we will have to go into a lot of research in the area of changing human behaviors with regards to hygiene and infection control. Uh, coronavirus infection has come as a awakening call in order to teach people as to how infection can be transmitted by hands. That was the primary thing we were teaching people 10 since the last 10 years, safe hand washing. But I think the message has trickled down now to the masses, and people have understood the importance of hand washing, hygiene, good cough and sneeze etiquettes. I think it is going to go into our genetic DNA, and it is going to do a lot of good to our not existing population, but the younger ones and the children who are going to be the builders of the nation in the future. So I think, in my understanding, as of today, we'll have to be very keen in looking at water, the quality of water. We will have to work with governments, other departments, including the water department, the Jal Shakti department, the other departments, which are line departments. We will have to collaborate to supply good quality water to people. That will be the primest duty of the health sector, to ensure that the public health engineering department or the Jal Shakti department, wherever it is called, will have to brace up, and the health department will have to test water from time to time at different sources, different places where it is supplied to people, and it is to be tested for microbiological contamination, while as the Jal Shakti department has to ensure that chemical contamination is not present in the waters. As I'm sure that if you go down into our country, down from Punjab till the central India, the groundwater is also contaminated very seriously. So we'll have to work on groundwater, on the municipal water wherever it is served to people, and we'll have to devise larger and more serious strategies vis-a-vis solid waste management, and including hospital waste.
Right, Mr. Khan, you rightly mentioned about how to prevent infectious diseases, and water is, as we all know, the most dangerous communicator of these diseases. But I think uh, I would like to take this discussion on the side that yes, prevention is important, but in the condition when this infection is there, uh, should we train our healthcare professionals to deal with such infectious diseases, and how to ensure the medicine accessibility properly in these low and middle income group of people? So today we have two experts from industry also, one from a group of hospitals and one from a pharmaceutical company. I will request Mr. Hasija to throw some light that what has been your experience in these states where they are dealing with COVID-19 at the same time TB and hepatitis. What things you are doing for the states and you want to do for these states so that the gap in the healthcare ecosystem gets fulfilled in terms of controlling the infectious diseases. Mr. Hasija, please.
Hi, good afternoon, everybody. So, I will share our personal experience here in India. Basically, as Dr. Kapoor rightly said, there is a there are central programs around infectious disease. One of them is viral hepatitis program and as well as tuberculosis program. They are one of the successful program here in India, and you can see that tuberculosis program is one of the largest program where now against SDGs we have taken an oath of eliminating TB from country by 2025. So we are moving into the direction. So we can see there is a good work happened around viral hepatitis, where Mylan as a pharmaceutical company, we have contributed a lot to the nation. I will say that at least 100,000 lives we have been saved by using remdesivir in the situation of COVID as of now. And viral hepatitis, we started working on this program, I will say 3 years back, and lot of success has been achieved by government in this case. States have started implementing the program in a big way. I remember in initial days when Punjab incidence rates were very high. Like most whoever when we used to go to villages and they used to understand screening patterns there, and we used to see that a lot of patients are infected. As Dr. Kapoor was saying, in Western UP also the situation was same. A lot of work has gone in that space. I personally believe end-to-end disease management is an important perspective with regard to infectious disease when you're talking about treatment. A lot has been talked about prevention here. Coming to tuberculosis, when we took tuberculosis as a disease, we saw that there were 3, 4 gaps. One gap was very clear. Pill load was so high, patient was taking 10 to 12 pills a day. And the second load was treatment duration was very high. Maybe it was going up to the month 24 months. So these two goals we took, and we decided we will work on these two goals. And today I can say with pride, our focus on infectious disease has brought better solutions in India, and now we have product like which can reduce treatment duration as well as pill load. So I think it's under evaluation with the drug control department, and we are very confident. I think that will surely reduce and will make better treatment outcome. Finally, I will say that end-to-end disease management is most important. The private sector plays an important role, and beautiful thing is our central TB program as well as viral hepatitis program understands this. They are involving private sector to eliminate these diseases from the country. Thank you.
Yeah, Mr. Hasija, I would like to ask you that for the larger states like Uttar Pradesh, Dr. Kapoor was here while you were sharing your thoughts, and he is here joined us back. I would like to ask you that for the larger states like Uttar Pradesh, how challenging it is for a company like Mylan to, contribute, and how can we experience, if you would like to talk about such states like UP, Bihar, uh, your views on this, please.
So basically, if you see us, we are actually as a private partner. We don't only believe in providing access of our medicines, but also we believe in building capacity. So if you see few of the states like Punjab, Haryana, we have done fantastic work managing the disease, starting from screening, providing a lot of information, awareness, IEC material, working very closely with government system to make sure every patient who is detected positive are given treatment. And then one more important tool was to really take care of the adherence of these treatments, because in case patient drops it in between, the patient has to restart everything, and the resistance can be a big problem. So we found that is also one of the problem, and we started working with the lot of states, and we did a hackathon 2 years back, and we could develop a good solution which can digitally manage all the adherence across these patients who are on our treatment. So a lot is happening, and one of the good area I see is capacity building, because the same healthcare professionals across states everywhere, they are doing multiple programs. They are quite occupied in doing many things. So a continuous education and continuous capacity building program I see is one of the gap, I think, which we can surely partner with states and work in that space.
Right, Mr. Hasija. As we can see that we are joined by Dr. Tatyarao P. Lahane, Director of Medical Education in Maharashtra Government. Welcome, sir. And before I request Dr. Lahane to share his views, I request Mr. Shetty, who has joined us since the beginning, and I would request Mr. Viren Shetty, Executive Director and Group CEO of Narayana Health Group, to please share on his views on this topic. Mr. Viren.
Thanks, Karthik. The private hospitals, of which I represent just one of them, all put together, right, the ones that are called corporatized hospitals, make up only 10% of the entire beds in the country. Added to that, you have these unorganized sector beds, which are either single proprietor-owned hospitals, nursing homes. The unorganized hospitals make up another 40 to 50% of the remaining hospitals. The rest are owned in the public sector. However, 2/3 of all the work that is done in this country is done by private hospitals. So whenever you talk about anything that has to be implemented in the country, you cannot go around working with a private hospital. But it is not a viable proposition for the long term. It is not viable because these are very expensive treatments you're talking about. And whenever the private individual, let's say a doctor, comes and sets up a institution. He has to pay for the land, he has to pay for the salaries, he has to pay taxes on everything that he does, and all the costs get passed on to the patients. And so ultimately, everything that you talk about in communicable diseases, see, most private hospitals deal with non communicable diseases, which are 63% of all the deaths in the country happen from non communicable diseases. But communicable diseases like TB, pneumonia, now COVID, have always historically been the domain of the public health sector. A huge part of the failures that you're seeing now in the public health response and the private healthcare response towards COVID has been decades of neglect, both from an institutional perspective, from a medical education perspective, and from, even as some of our panelists spoke about earlier, a seriousness of purpose perspective. The needs of healthcare became conflated with the needs of just providing payment for healthcare services. Providing healthcare is not the same as providing payment for healthcare. While Ayushman and programs like that are very good programs for providing people who cannot afford a way to pay for healthcare, the fact is you will get more out of investing in clean drinking water, improving the public healthcare, improving the sanitation systems, improving the sewage and nutrition systems, making children in safe environment where they are protected from the elements, and improving the training and education. We have one of the worst performing healthcare systems for any lower middle income country. And we're doing the best that we can. But everything that we're trying now almost resembles the efforts of the student who spent the whole year goofing off, not studying, not looking at the books, and just when the final exam comes, he's running around like a headless chicken and just trying to cram as much as he can in the last second. It's not going to happen, right? Whatever we do and whatever's happening now, we are reaping the sins of all our past mistakes. So I would say that let this please be the wake-up call for private hospitals, for doctors, for policymakers, and to understand all the things that have brought us to this point. We don't have enough doctors because doctors did not want more doctors to be created. We don't have enough hospitals because land is horrendously expensive. We don't have enough public health systems because the government has focused a lot more on building very expensive, very good institutions on the AIMS model while completely ignoring basic care, primary care, secondary care, and preventative care. And so we need to get our priorities in place, because you look at where we are now, the entire world has been stopped. The entire global economy has come to a standstill because of a public health emergency. So it is clear, as a society, at least we know where the priorities are. The health and safety of our family is the most important thing. Everyone knows that. Now the hope is that we all start to act like it and take the steps that move in the direction of providing universal access to care, universal access to medicine, universal access to safe and efficient surgeries, without getting too hung up on trying to follow old and trodden business model, because the fact is, as a country, we simply don't have the kind of money to follow the same path that the Western world has gone through. We can't. There's simply not enough money. So if you say something like medical education has to happen in a medical university, is it that easy? If you go by the rules of the MCI, you need a 500-bed hospital to a 1,000-bed hospital attached to a medical college. And each medical college has to have its own hospital. You need 35 acres of land. You need laboratories. You need massive operating rooms. You need a huge number of patients to come. A medical college in India cannot be set up for less than 500 crore rupees, with only an intake of 100 students every year. How is this going to be sustained when you need to create millions and millions of doctors going forward? When our children today are being forced to learn online, why is it that we can't make doctors learn online and get all the training done on the apprenticeship model? So I would say that there is a lot that needs to happen. I think there are an incredible number of civil servants, public policy intellectuals, people in the government that want the best to happen. But now is the wake-up call for us to get on a common forum and work through the differences and make a system that works for all Indians, rather than demonizing any one particular system or another.
Right, right. Uh, Great points raised by you, Mr. Shetty, and love the way you expressed that how the gaps can be fulfilled. I would like to first congratulate Mr. Lane, Dr. T.P. Lane, who is Director of Medical Education, for a great work Maharashtra is doing in terms of controlling this COVID-19. Dr. Lane, I appreciate you for that. No, but there has been challenges, and we have actually realized that there have been many challenges in our healthcare system and our medical education system in the whole country. COVID-19 has somewhere made us realize. So, some points shared by Mr. Shetty and others also. So, I would like to first know from you, Dr. Lahane, that how Maharashtra is dealing with infectious diseases, and what are the gaps that you have realized in this crisis, and how you are not letting this crisis go wasted, and how you would like to use this crisis of COVID-19.
Thank you, Karthik. See, in Maharashtra, the medical education and the health is a
Yes.
separate department. So now Dr. Sadhna Taide is also going to join. She will cover most of the part of the health. What Hiren was saying, that the problems at the primary level, yes, of course, it is not in Maharashtra but all over India, and it is in all developed country. These problems are there. But as in the once it has started in, you can say, the COVID, then we planned the strategies, and after planning the strategies, in Maharashtra it is today also number one cases. So I will just share with you few things what we planned, and now mm, uh, how I can share, I
Yeah,
don't
you
know.
can share screen. uh,
Okay.
Rajeshwar, if you Deepak,
uh,
uh,
Screen sharing is with two monitors. Screen sharing. Can I share this?
yeah, you can
Share.
click on share screen,
Okay. And then,
and then you must be seeing a screen on your
yes, it is there, but I should see the desktop, na, so that I can um,
uh, please
what,
click on the screen.
click here, na,
Yeah.
and share.
Yes.
Okay. But okay. Now this is what coming is.
We can
Uh,
see your screen. You need to just start the PPT, and like in whatever
so
format you are present.
my screen is not seen, na?
We can see your screen, sir.
But I can't see my screen. Okay, I will see.
If you just start the PPT.
But how can I can start, because here I can't see my screen. I can see some Milan and all other things, but it is not seen.
You
1 minute.
can go to your PPT.
1 minute. Something wrong. 1 minute. Mm, I think
Deepak, can you help? Can you help Dr. Lahane in this?
it is showing some tips to me. Don't show these tips me. What is in screen sharing is easiest with two monitors. So, ठीक है. Share screen. Now the
Deepak, can you help here?
uh, so I think there is some problem is coming.
Okay. I'll just ask Herschel to check with you on this.
Okay. Okay. I think there is some problem. I'm unable to share it. Mm, somebody can help me here. Okay.
Surely,
Till
sir.
that time, uh,
Yes. In the
or
time, if you
otherwise,
can, yeah.
Okay.
Meanwhile,
Till that
may I
I
ask?
can. If any other speaker is there,
Yes, yes, yes. Meanwhile,
he
I
can
ask.
Hello.
ask some
Yes,
other
yes,
speaker.
Hi,
yes. Surely, surely.
hello, Lahane sir.
Yes.
Please click on share in screen button.
Okay. One, share in screen. Okay.
Yes. Then click on application window.
Share in screen, and then on the
Then
application window. Okay,
yeah,
application window. Ah, and then
then you can share.
application window. Then share is not coming. Okay. Yes, share. Uh, but my desktop is not seen here.
You have shared the screen already, sir, but we cannot see anything there.
That is the problem. I can't see the computer. So if you can go for the other, don't waste the time. Somebody can come here.
Okay,
Other
okay.
part.
I asked Harshal to call you. Meanwhile, I request Dr. Kapoor to please continue. Dr. Kapoor, you just got disconnected while you were speaking. Dr. Kapoor, can you hear me?
Kapoor is not seen. Kapoor is not seen. Why it is not happening? I don't know.
Okay. Okay.
Okay.
Not a problem. Not a problem. So,
I will go ahead and I will tell you the. But this is
if you can say share views without PPT, sir, you can
yes, I
read.
can. No, the reading was good, but as it is not seen, I know what has happened. But I can't see the PPT. Okay,
Hello,
I will save the views. Okay.
please, sir, please.
Hello.
So when the COVID, see now on the 9th March we got the first patient in Pune, and after that the government,
Yeah.
the Maharashtra government was the first government who
Hmm.
started this can say this the on 16th of this month March we came with the GR,
Okay.
and Maharashtra government started acting from 17th of the March.
Hmm.
Lockdown was declared on 17th of the March, and then the can say the medical education, then the health department and the corporation together we were working. See, we were having only two institutes, that is in Mumbai and that one is in Pune, with 150 bed and 100 beds for the infectious diseases. All other infectious diseases were taken care by the wards in each and every medical college. That is a ward of, you can say, 50 bedded, 40 bedded, like the wards were there. And in total, when we calculated, that was only 600 beds in Maharashtra that time. And the laboratories were only three laboratories.
Hmm.
So then we started we must increase one laboratory every day, and like that we up till now we have got 154 laboratories. Out of that, 85 lab, that is laboratories are from the government, and the others are from the private. The same thing we decided that yes, it is not only the laboratories, but it is also required the beds, not only the beds, but
Hmm.
also require the ventilators, not only ventilators, but we require the ICU beds. And
Hmm.
with the same time we decided to increase the beds, and
Hmm.
whenever we were increasing the beds, I will tell
Hmm.
you today there are 6605
Hmm.
ventilators are working in Maharashtra. Those are working ventilators, I'm telling you. And there are uh, 13,000
Hmm.
ICU beds are there. Total beds in Maharashtra are 3,60,000. So these are the number of the beds we added in this 6 months time. The secondly, the if you see the investigations, we are investigating near about the 70,000 tests every day. So
Hmm.
uh, we have increased also the test. Also, the you will see the Maharashtra is the first where we asked we appointed the task force, central task force. Then we appointed the task force in each and every district, and these task force are guiding us the new drugs, that is the remdesivir, tocilizumab, favipiravir. This was asked by the government of Maharashtra only, and the government of Maharashtra asked the this the drug control of India, and now did these drugs are available as a off-label emergency use. The same time also we have started the plasma, the plasma trial of the for the 5,000 patient in the 23 medical colleges. This is the largest you can say in world. So this type of trial we have started. Then another thing is we have trained the people. It means the training started from the each medical college was given a this one that target that the people required for this treatment they should be trained. So we trained the people in each and every medical college, and today there are 25,000 teachers and paramedical workers are trained in medical colleges. Now, I'm not talking about the health. In the health, it is 80,000. So this is what is the training we did. At the same time, the number as the number was increasing, the doctors were not there for the medical colleges. Then we asked the private practitioner to join. The private practitioner joined in hand. 4,600 practitioners they joined with us. At the same time, the Ayurvedic, then the homeopathic doctors, then again the interns. 4,250 interns joined with us. Then the third year students and third year nurses, they joined with us. And I think because of that, all in Mumbai, you will see there are 23,000 beds in the DCSC and DCS, they are working. So it means Mumbai was first a hotspot, and then the you will see of the Dharavi pattern, which was there in Mumbai, that we screened Dharavi, and it was a very crowded population area, but we could reduce the number there. It means what we have done is wherever required, we did the screening. Screening was done uh, 20 behind one patient, and accordingly the patients are not kept there, but they were brought out. 42,000 patients were removed from that place, and they were kept in the CCC centers. So CCC centers after the DCSC and this DCS, these are hospitals, and then the uh, now after that also, because at the beginning for 2.5 months private hospitals were not working, so we requested all the private hospital to take part in this, and the private hospital joined with us. 80% of the patients in the private hospitals are admitted by the government, and they are working on the government rates. 20% were kept for them. Now we are planning to reduce it. But like that, the Maharashtra, as you know, the number was so much. But Honorable CM sir was leading us not only by the leader but as an example, and he was guiding us. His knowledge is equal to the doctor, and because of that, I think the Maharashtra has done good. The whatever number is now increasing in the periphery of the district, so that is because the now the patients are afraid of whenever the patient comes positive, then they feel that when patient comes positive, then they go to the hospital, and then there is no any relation, nobody can go and meet them. Because of that, they are afraid of. So now we have started that my family, my responsibility by our honorable CM sir. So that we are now going to go to each and every house in the Maharashtra, and we are going to not only screen, we are going to screen oxygen, screen temperature, and also ask them about the any problems with them, and then if there is a something, then we are going to test them, and after the testing, we will bring them to the CCC center, and once they will come to the CCC center, they will be treated. Secondly, those who are having nothing, then we will teach them, because see, whatever today we are listening immunization medicine, there is not a direct medicine against COVID-19, but what immunization is there? Using the mask is the truth. If we use the mask, the infection is not much more. Infection is reduced. Then second is the distancing, and third is the sanitization. So we are going to teach them about the mask, utilization of the mask. Mask is very very important. Then second is the distancing. So they should keep the self distancing. That also we are going to teach them. And other is the sanitization. So three things are important whenever we are going through the pandemic. Now this pandemic he has taught us so many things. Like Hiren was telling that so many things are required in health. Yes, we require more doctors. Definitely, so many doctors are required because today doctor-patient ratio, if we hear the doctors are very less. So we require the paramedics, we require the doctors, and also we require the budgetary provisions in that, and that is very very important. So I think the number of the colleges, instead of increasing the number of colleges, those colleges which are there, in that we can increase the number up to 250. And the colleges where now you see in the rural area, it is difficult to get the teachers. So in the urban, we can have more colleges, and the doctors. I think we will have to produce more doctors. This is the need of the hour, need of the day, need of the country, and I think those people will only help us for such type of pandemic and epidemic. So today we are going through such a pandemic that where the relatives of the family or anyone when he dies we can't also meet that person. Such type of pandemic we are going through. So what we require is such type of pandemic if arises in this in the future, then we'll have to face in future. So Honorable CM Sir has decided to have 5,000 bedded hospital in Mumbai and same at different places, so that it can be used for some other activities later on. But if something goes wrong, then the 5,000 bedded hospital can work. It means we will have to also see for future how we can face such situation. But basically, we will have to go for the such type of diseases. It means the infectious diseases hospitals minimum not in district but in the division. It means in 3 4 districts one hospital. We'll have to train. There should be a research institute for the infection so that it can prevent and also tell us how to go ahead. So all these things we are taking the step in Maharashtra, and I will tell you really Maharashtra is doing very good work for the COVID pandemic. Today the also the death rate, we are thinking the death rate to reduce down, but the people are coming on fifth day because they are not knowing that this disease causes the problem when we go late. So that we are now teaching them by this program, and I think within a month time we will reach everybody's house, and we will try to reduce the number of deaths also, which is happening today 3.1%, that will reduce to less than 2. So that is what we are trying, that we must go to each and every person and educate them. Education is very very important in such pandemic.
Right,
Thank you.
right. Dr. Lahani, you rightly mentioned in the last sentence that education is very important. And I know that you also have raised this point that yes, we need doctors, we need healthcare professionals, and we need ecosystem, yes. But as last line suggests that education is important. So Mr. Naresh Hasija is here, Associate Vice President of Mylan Pharmaceuticals. Mr. Hasija, as Dr. Lahane told about education, we can see that a capacity building and training of the existing healthcare professionals, including doctors. I think we getting the more numbers is a longer term process, maybe, but the existing ones can be more productive. What can be done in the states like Maharashtra?
I think very well said, and we are in touch with Dr. Mahane for particularly this. So I will say that I think healthcare capacity building right now is very very important, and I think digital is taking a good space in this area. We have started doing this through our digital partner. So what we have done is like we have tied up with them, and there are CME accreditation points for doctors, and a lot of modules has been already created around COVID, and these modules are now getting started disseminated at the bottom. So till now, few medical colleges doctors have already attended these programs, and we have taken good feedback. We always interact with Director of Medical Education to take their inputs for the state. So we will be keen to participate in building capacity, because we believe that I think jointly we all can really handle it very well. And as Dr. Lahane also said that the kind of work Maharashtra has done it's an amazing work. the way they have controlled the pandemic, and we are very, very keen to partner because here modules and all the education materials are ready, and we have digital platform to take it forward in Maharashtra.
Okay, okay. Mr.
Thank you,
Hasija,
Naresh.
and yeah, Dr. Lahani, please.
Thank you, Naresh. Naresh, this Mylan is definitely helping us. Even they have reduced the price of remdesivir yesterday only. I think whenever the companies are coming and helping us to treat the patient, to educate the people, I really appreciate Hiren. Naresh, thank you.
Thank you.
Thank you, Mr. Lahane. Dr. Umesh, I would like to ask you that such training and also I think medicine accessibility in terms of the COVID-19 and the TB and hepatitis. What do you think? What developments can be done in this sector in a state like Bihar, Dr. Umesh?
Yeah. So, in continuation of the talk, there's definitely a challenge of in TB simultaneously a drug resistant TB, and definitely the treatment is changing day by day. As Dr. Naresh is here and he is well aware that PMDT guideline 2017 followed by 2019, and the use of newer drugs like bedaquiline, which was said by our director from UP, Conclave disease, as well as the delaminate. Definitely, these are the life-saving drugs in the extremely drug-resistant TB and drug-resistant TB, saving the additional life and very fruitful result we are observing in the field. That is conversion rate and weight gain and symptomatic patients are getting relief. So in terms of TB, definitely these additional drugs are saving the lives, and maybe in 6 to 7% the drug-resistant TB, followed by out of that 40%, 50% are required. These drugs, as per recent NDRS data and other field reality, what we are observing right now. So definitely these are the additional update and activities required. The needy patient, either in public sector or private sector, each and every TB patient is a patient. Either he is taking the services from public sector or private sector. It doesn't matter. A TB patient should get the services, integrated diagnostic algorithm. Here's that each and every TB patient should get the drug susceptibility testing, DST, for providing the appropriate regimen at right time at right place. So followed by other newer diagnostic. Thanks. A newer diagnostic technology is with us in TB. Many improvement we have evident in the last few years, like CBNet, followed by LPA, and TrueNet has come. So decentralized diagnostic services has come up, and followed by simultaneously program is getting the newer drugs for controlling the TB as ambitious goal set by our honorable Prime Minister to eliminate TB by 2025, which is 5 years ahead from the Sustainable Development Goal. Okay, SDG. Regarding and definitely the capacity building, what I have done actually, I had worked 7 years in UP. Recently, fortunately, I had worked 3 years in Bihar. First posting with WHO in 2009 to 12 was I was in Bihar. So taking that experience, WHO has given the opportunity to work again in the Bihar at the state headquarters. Earlier was I was in field. So definitely the knowledge capacity I have attended with team of Mylan for the capacity building in the field with bedaquiline team and all these things. So definitely that capacity building, utilization of the drug to whom we should provide and how it can be provided to the needy and needy person. So definitely that is need of the hour, and certainly NTP program, TB control program is moving ahead, and due to priority, and it is being monitored by Prime Minister Niti Aayog, Prime Minister Office. So due importance is being getting in the TB control program. Simultaneously, COVID, definitely the testing capacity has been increased by providing this TrueNet as well as the RT-PCR mini lab has been said by our earlier speaker. The mini decentralized lab been set up in also Bihar, And so in that way, COVID and TB, fighting against these communicable disease, state is working on in cohesive way and comprehensive way. And in capacity building, what is was raised and importance was raised by our directors. We can say that the aims and other people are working, and definitely the digital platform is working a better way in this pandemic situation to increase the capacity of the, and definitely the Milan and Dr. Naresh, and definitely the knowledge gap and training is gap is here. We observe it, and I would maybe state program. I am here with in the place of State TV officer, Dr. K.N. Sahai, who has to be here, but unfortunately he is busy with other meeting, important meeting. I am getting the opportunity and thanking to all of you for providing the opportunity. But I would request, and if Dr. Naresh is ready, so providing the capacity building with nodal and other for utilizing and effective management of drug resistant TB and other communicable disease in the state of Bihar. Thank you.
Yeah, thank you, Dr. Ramesh. Mr. Hasija, your views on this? He's mentioning myelin.
Yeah, Karthik, I think in tuberculosis we are actually doing a lot of things, and as Dr. Umesh said that
Okay.
we are strong partner to WHO. We keep taking advice on our tuberculosis capacity building modules, and very soon we will be
Okay.
rolling out digital solutions in consultation with the WHO of India. I think we are working very closely. Bihar, UP Bihar is our top priority because we understand disease load is very high there, and with COVID, I think it is now increasing. Tuberculosis is increasing in those states. So we have done a fantastic work in a district in Uttar Pradesh called Bahraich, where we have touched 1 million population in few months' time, and we did massive active case finding program there, and then we connected all the identified tuberculosis patients with the central TB program. All those patients were notified, and now I think next level of follow up is going on with those populations. We would like to replicate the same things in the state of Maharashtra and some other states where, like, we feel there is a real need. Thank you.
Right,
Yeah.
Mr.
So
Hasija.
yeah. So Karthik, I evident the my presence of District Bahrais. Fortunately, I had an opportunity to facilitate one session for the private sector engagement in NTEP. So evening session for 2 to 3 hour session. It was a very interactive, very well organized by the Milan on that place. So I appreciate and expecting so further decentralize and further movement in this regard. Yeah. So over. Thank you.
Great, Dr. Ramesh. Great to know about that. Now I request of each speaker to give concluding remarks, and I will start with Dr. Duryodhan Chavan. Dr. Duryodhan, are you here with us? Dr. Duryodhan, we are wrapping up this session. I request you to give your closing remarks, please, in short.
Yes, sir. As Lahane sir very well said, we are managing COVID situation very safely. We can say we have saved so many people, and as sir rightly said, there were only 2 to 3 labs in the initial phase for COVID investigation, and we have increased it to almost 550. Likewise, sir, we are having separate directorate at Pune, which is dealing with other infectious diseases, and we are running all the programs successfully, including tuberculosis control program, hepatitis control program, and NVBDCP, National Vector-Borne Disease Control programs. All the national health programs which are run for infectious diseases, they are doing very well, sir. But as COVID has hampered total population, so there was some effect on all the programs, including our the specialist subject like eye care, uh, Lahane sir is a very big man in that we can say. He has done so many cataract surgeries, and that work is also hampered due to this COVID situation. So as soon as we come out of this pandemic, we will try to cover up or provide those other services to the public, sir. So that was from our side, sir. Thank you very much.
Thank you, Dr. Duryodhan. Mr. Viren, you had actually raised very important issues in your short speech, and I think it has been discussed also at some extent in this panel discussion. After a discussion of this long, what are your views? How you summarize this, and some sort of solution you see?
There's no easy solution. There's no magic bullet for any of this. This is all hard work. We are the country with the largest number of COVID patients in the world. We may be a little behind US, but I'm pretty sure we'll overtake them very soon. Around 1,000 people are dying every day. If you go by the epidemiological trend, it's quite likely to double per day by the end of the year. But regardless, I mean, it's a very big country. And even then, with the COVID death rate and all of that, the number of people that die in traffic accidents and diabetes is way, way more than COVID can ever damage. But we need to focus a lot more on our basics, which we still don't have proper. Forget about achieving the levels of Western countries and, let us achieve, at least get to the same levels of healthcare spending as Thailand and Vietnam. Let's get a moderate goal for ourselves in terms of at least 3% spending of GDP on healthcare. And let's get 10 lakh doctors into the system as soon as possible. And let's have, as the government has very wisely decided, to create parallel streams of education under National Board of Examinations for training in the diploma for basic services. So communicable disease has to be one where you create a parallel cadre of doctors who don't have to be super specialists, who only want to work in big hospitals in the city. There is adequate infrastructure available. We just need to use it more smartly. The government has more than enough infrastructure. I would argue you don't need more 5,000 bed hospitals because you're concentrating resources on the wrong problem. Right? We've seen in our hospitals, one of them, which is in Mysore, a 10 crore hospital, which is 200 beds, non-air conditioned, fully open air, built exactly like a government hospital 50 years ago was built. It's doing a much better job of treating COVID patients than our fancy multi-story air conditioned buildings because of cross infection. So if the idea is to go after communicable diseases, there's no need to build these Taj Mahal type buildings, which cost hundreds and hundreds of crores of taxpayer money. It can be done in a very low cost manner. So please keep, I would say, what would be a solution is that be realistic about where we are. Just try and be more like Vietnam and Thailand rather than US and Europe, and do things in a more moderated way while sticking to basics on training, healthcare, education, sanitation, clean water,
Mr.
nutrition.
Shetty, I would also like to ask you that I have been hearing from years that Narayana Health Group is popular for its CSR activities and the work for society. I think in COVID-19 also, can you share your experience how Narayana Health uh, ex- dealt with this pandemic in the country?
So we raised a lot of money from civil service, civil society. We raised money from corporations. We donated ventilators to government of Maharashtra, government of Delhi, government of West Bengal. We treat a large number of COVID patients from the government hospitals. We have donated foodstuffs for migrant workers. All the things that you're supposed to do as a responsible member of society. But that is not, I would say, the most important point of what we do. Most important thing that we do is we're trying to make healthcare more accessible for everyone by providing systemic change. Right? We focus on training and education because one is it improves the quality of delivery in our hospital, but these doctors and nurses go forward and they start to work in other government hospitals and set up other places. Right? Capacity building is the most important CSR that we do, but that comes for us as a cost center. And the other one is we are investing a lot in technology and a business model that shows that healthcare can be delivered at a very low cost and a reasonable price. And we want people to copy that, not to blindly replicate the Western models of providing healthcare, which is in these grand buildings.
Right. That's great, and I hope that groups like Narayana Health can keep on collaborating with society and the government, and if all make such contributions to the healthcare ecosystem of the country, I think there'll be very good results coming in coming years. And now I'll request Dr. Lahane to please give us the concluding remarks, sir. आपके closing remarks, sir.
I think I heard everybody, and in this pandemic, because we were not knowing the pandemic from near about 1897. So plague was there. After that, in 1920, then we got small epidemics. Can say not a big pandemic. And first time, and I'm 63 years old. First time I'm experiencing such type of thing. So we'll have to be, I think, scientifically go ahead, and whatever the infectious diseases people, our WHO, they say, they guide. So like that, we should prepare. And like the, I think even GDP will have to now consider, because in the developing country, they were not using even one GDP for the healthcare system. So we'll have to go not only three but up to six for the GDP. That should be used for the healthcare. And we have to, by any means, produce the doctors. The doctor-patient ratio should be, by any means, will have to increase. And not only the doctors, but also the paramedics. Today, we'll have to consider the technicians, consider the nurses, because these are the people who are going to treat patient inside. And the doctors are also required to guide. So basically, the where we are lacking is the paramedics. In India, the paramedics we are lacking, because here the patient comes to the doctor and doctor treats. But if you see in the developed country, the 80% work is done by the paramedics. So that we'll have to see here also. We'll have to train, because today we are not having the anesthesia technician. We are not having the radiology technician. We are not having the intensivist technician, because these technicians are very important people. And small thing that the our machines are not working, because we are not having the biomedical engineer, and so our so many ventilators are not working. So we'll have to produce these all type of people who are required for the health services. It is not only the doctors, but from doctors downward everybody, and also the specialist. Because today what is happening, I will tell you, in Mumbai there are only 40 intensivists. In Pune there are only 20 intensivists. But I will tell you, there are 18 districts, there is not a single intensivist. So we will have to produce this, as the DNB has came forward. The same, the MCIs also came forward, and our university, that Maharashtra University of Health Sciences, now we are going to produce the six type of different essential services courses for 1 year. So we'll have to. It is not required that he should be there work for near about 12 years to produce an intensivist. So within 1 year, 2 year courses, we can produce the intensivist. Those are too much required. So we will have to see plan. Unless and until plan, we should not go ahead. And after the planning, then I think uh, do the whatever the required in future. But I think this COVID-19 has taught us a lesson, and I think everybody now should come together. That may be a government, that may be can NGOs, that may be private hospitals, or that may be a people you can industrialize together. Yeah, put a hand together. We'll have to put a hand together, and then we'll have to develop the whatever the type of infrastructure, doctors, paramedics, and everything. And that, I think, in the future, if something goes wrong, we can face the situation. That is what I
Thank
think.
you, thank you, Dr. Lane. Quickly, Dr. Umesh, your views, in short. Close it.
Yeah, so for concluding, definitely, as told by all the speakers, that this COVID pandemic taught a lot to all of us for changing the hygiene as well as the hygienic condition and involvement of the health sector, as well as improvement of the health system of this country, because maybe the GTP additional involvement and deploying the money to the health department and need. Maybe in future, the health system and infrastructure as well as the systematic way of health system care services for the country may improve in future. So we are looking forward by this development. Maybe it will be evident
Okay.
to all of
Thank you.
us.
Thank you,
Thank you.
Dr. Umesh. Mr. Naresh, I would like to share your closing remarks, please.
So I think, first of all, I would like to thank each panelist for bringing a really a diverse panel here. and a lot has been talked about infrastructure. And really, I think this pandemic is teaching us a lot, and it's an opportunity to really create a good public health as well as private infrastructure. With regard to our um, our system, I will request all the states basically to have a better planning with regard to prediction of the cases. As Dr. Viren was also saying that, I think based on that we can do a good modeling of backend, so that we can also let your requirements know what are the products you will require in coming months and what will be the quantities, so that we can keep our backend ready and our country really does not go short on any of the medicines.
Thank you, Mr. Hasija. And before we wrap up, I request all of you that on 30 and 31st October, we are coming up with the Healthcare Transformation Summit second edition. And I request all of you to please join us there. Also, we'll be having a discussion on various burning issues and on very interesting topics with interesting speakers. So I request all of you to join. And Viren, actually, your thoughts were really interesting, and our that theme of our that event will be on National Digital Health Mission. One of the major themes will be that. So we'll love to take all of your views, and we're in there also if you spare some time. Because I was reading that Narayana Health is also I think that these hospital groups, if they contribute in National Health Mission also, Digital Health Mission, as you said that you are all focusing quite well on technology. So do you think, before I wrap up, I ask you that are you very hopeful of National Digital Health Mission?
Yes, absolutely. But to put in context, digital is the tool. It's not the solution.
Okay.
It is a means of getting to what we need to achieve. It's not a replacement for a doctor.
Right. True. I think we got a good point of discussion for our event, and we'll keep all of your thoughts in our mind before framing the discussion points for our next event, Healthcare Transformation Summit. I request all of you to join there. And thank you, Mr. Hasija, Dr. D.P. Lahane, Dr. Duryodhan Chavan, Dr. Umesh Tripathi, and Mr. Viren Shetty for joining us. It was wonderful discussion. Thank you for sparing time for us. And here we wrap it up. Thank you so much.
Thank you.
Thank you.
Is good good enough?
Thank you.
That's what we ask ourselves at Mylan. When we see dreams getting hindered by poor health, we feel good is not good enough. When possibilities can be accessed by just a few, good is not good enough. When health comes with a condition of affordability, we know good is not good enough. For more than half a century, we at Mylan have helped create better health around the world. We market more than 7,500 quality products that help people in more than 165 countries.
Because good health gets better only when it becomes more accessible to all. At Mylan, delivering better health for a better world isn't our job, it's our mission. Mylan, better health for a better world.